Well, we're going to get more information very soon on how lethal this is and whether it's susceptible to the vaccines we now have. But I think we've been right to say everybody should be getting vaccinated where possible. Everybody should be tested where there's a risk. And that's true of our country, but it must be true of the rest of the world as well, and particularly Africa. So few people have been vaccinated, only 7%. So few have been tested, hardly any tests are being done in Africa, so you don't detect things quickly enough. So when the G7 ministers meet this morning, they should agree that they will coordinate a month-by-month plan to get vaccines out to Africa and to help them get testing equipment. And when the World Health Assembly meets, which is this morning, they should agree on a new treaty so that we can prevent pandemics and deal with them properly in the years to come.
I did speak to the government minister this morning, the health minister, in fact, and he was saying that, we have sent, as part of the COVAX scheme, we have sent vaccines to Africa and other parts of the world, and we will continue to do that, and we'll be up to about a third of the level that we've committed to very soon.
I don't think that's strictly correct. I mean, Boris Johnson said on Saturday that Britain was leading the way. We offered 100 million vaccines. We've provided only 11% of them so far. America has offered 1 billion vaccines and provided 25%, and even that's not enough. So Britain's record's not very good. And when Boris Johnson said on Saturday that the real problem in Africa was that people were not taking up the vaccines, he was wrong, because the real problem in Africa, the biggest problem, is the lack of supply. And as soon as we could get the supply out to Africa, then I'm pretty sure that the countries that have been identified as red spots by the British government, we can get vaccines into people's arms. It doesn't help us when there has been a collective failure to get vaccines out to everybody in the world. Low-income countries, it's 3%. Britain, it's nearly 70%. What a difference, despite the fact that everybody should have access to this vaccine.
And DR Congo is 0.06% fully vaccinated. I think I was reading this morning, former Prime Minister. World Health Assembly getting underway today. It's a 3-day session examining global preparedness and responses. What is it that you want to come out of that?
Well, there should have been far better early warning systems. There should also have been a far better exchange of medical goods when people were in difficulty. And, of course, there should have been equity in the distribution of vaccines. All these should have happened. And I think what the World Health Assembly should do is say, look, we want what you might call a pandemic non-proliferation treaty. We want to prevent this happening in future. We've got to act now, of course, and get the vaccines out. But we've got to be prepared for further variants and for further outbreaks, and we don't want them to become pandemics. So let's have a new treaty where each country binds itself to take the early action that should have been taken and should still be taken when it comes to vaccines.
So what should we be doing to try to protect the British public, though, as well? Do we literally need to pull up the drawbridge every time we hear about a new variant?
Look, I've been very clear, speaking on behalf of the World Health Organization in this instance, that we've got to get vaccines out to the rest of the world, and there are probably about 100 million vaccines in the West that will be wasted by the end of the year because they're not going to be used. And I think people hate waste and hate the idea that vaccines will pass their expiry date and not be used. As far as Britain is concerned, I heard you interviewing Angela Rayner and the Health Minister already today, and what they're saying is absolutely right. You've got to act quickly. In September, I think the SAGE Committee recommended the wider use of masks. That has got to come in, obviously, and people have got to take the advice about hand washing, the social distancing and so on, if we're going to avoid some of the problems that came last Christmas, this Christmas, and of course if we're going to avoid this going into the new year. We've got to take this early action. It's pretty clear that that's what's necessary.
So a couple of things to unpack there, former Prime Minister. First of all, as far as masks are concerned, the government says you don't need to wear a mask in England if you are in a pub or in a restaurant. Obviously, if you're eating, drinking, of course you're not going to. But what about if you're standing at the bar? If you're in Scotland, of course you know that you do. Do you think that that's something the government should be looking at again?
Well, I think that advice is probably going to change in the next few days. I've always been very careful not to second-guess the medical advice, but I think the medical advice from September has been pretty clear about the wider use of masks. And of course, we now have some cases in Scotland this morning, as well as cases in England from the weekend. And I think people will be far more vigilant in future and will be wearing masks. And from tomorrow, of course, in England, there's new laws that will require people to do so in public transport and if they're in shops.
And as far as PCR tests are concerned, the government again decided that they weren't necessary when people were either the 2 days before you came back to the UK or indeed the 2 days after you were back in the UK, didn't need them anymore. Do you think those should be reintroduced as a matter of course? I'm talking particularly about the ones in order to get into the UK.
Yes, I think this issue about taking tests before you come to the UK will come to the fore. Again, when the G7 health ministers meet this morning, there probably should be a collective agreement that we'll all do roughly the same things when we're worried about this. You know that Japan has already closed flights. You know that Israel's already done it. Morocco's already done it. So you're going to have different countries acting in different ways and a lot of confusion. It might be better if the G7 could agree a collective approach to what you do about testing before you come to a particular country and, of course, testing once you come into a country. But, you know, the general point I want to make is that if we're talking about things that must be done in the United Kingdom, and I agree, get vaccinated if you haven't been vaccinated, get testing if you haven't been tested, and you think there is a problem, then that advice must apply to the whole of the world. Otherwise, this disease will continue to spread somewhere else, it will continue to mutate, and it will come back to haunt us, even the fully vaccinated, if we haven't taken action in other countries where the disease is spreading.
Some of those countries, particularly Southern African countries, are saying by the time we get these vaccines that you've promised us, the shelf life is so short on them, they're useless, and we can't have a campaign, a concerted advertising campaign to make sure people do get vaccinated. There is a consideration, a thought that actually the use-by date on these vaccines is just too short. Is that something that should be looked at again?
Yeah, that is a real problem because we talk about leftovers. When you've got extra vaccines, you get them out, but probably at the last minute to the countries that are needing them. The better way is to think, look, we're producing soon 2 billion vaccines a month across the world. There's going to be no difficulty about countries being able to get hold of them if they're rich enough to be able to afford them over the next few months. If we have excess supply and we know we're not going to use them in the next few months, then we should get them out as quickly as possible. This is all about coordination. If the G20, the group of richest countries, could agree that they would have a coordinator so that we had a month-by-month plan, then we would not run the same risk of 100 million vaccines being simply wasted. Now, if you waste a vaccine, you're actually putting a life at risk because that vaccine could have been a life-saving, something that could have saved lives in another country, if not our own.
Yeah, and just as I'm talking to you, hearing from the Scottish Deputy First Minister saying that there's no travel history in some of the cases of the Omicron variant that have just been discovered in Scotland, that would suggest perhaps it didn't originate in South Africa.
Well, we know now that the first news of a potential problem was November the 11th, and I think it was in Botswana. And we will find more in the next few days about where this originated, what its lethality is, as well as how transmissible it is. So we need that medical expertise. Luckily, we've got one of the best sequencing operations in the United Kingdom to enable us to do this. And South Africa is cooperating in a way that has been helpful to getting to the bottom of this. So I do believe we'll find out more information in the next few days. And of course, the key question is the vaccine that is in our arms or coming into our arms going to be able to cope with this new variant? And I certainly hope, and I think everybody will hope, that it can.